Hello?
Hello, this is Ava, a digital medical assistant calling from Pine Park Health. May I please speak with Mr. Mike Tadlock?
Hi, Eva. This is Mike.
Thank you, Mike. I'm calling today because Erin O'Hare will be on site at Sunnydale Senior Living on Thursday, November 27th, from 9 a.m. to 12 p.m. to see patients. Will you be available for a routine checkup appointment on that day?
Yeah, that should work for me.
Thank you for your time today, Mike. Have a wonderful day and take care.
Hi, my name is Mike Tadlock. I'm the Chief Operating Officer here at Pine Park Health. Pine Park Health is a geriatric primary care practice. We've grown over the last 3 years to visit residents inside of nearly 200 senior living communities in California, Arizona, and Nevada. So some of the biggest challenges we've faced really involve our patients. Our patients are older. They tend to be phone-first communicators. And what that meant for our operating teams was that we had to be on the phone all day long to get them scheduled, to do reminders, to do medication refills, really all of our operational tasks. And as we grew and grew and grew, we really had a time bottleneck on what we had our medical assistants focused on, and we wanted to get them back to patient care. As we thought about how to solve this problem and get our medical assistants back to providing patient care, we looked at a variety of solutions. And because our patients are phone-first communicators, we started looking at AI agents to solve the problem. And ultimately, we came to Retell and found a solution that we feel really good about. Some of the unique capabilities that Retell offers, which I found really interesting as I was working on who to work with, were the self-serve UI in particular. With the other vendors, and frankly, in our attempts to do this ourselves, I had to go to the engineering team every time I wanted to make a change to either the prompt or the workflow. We've built 2 agents so far. The first one's name is Ava. Ava calls to do reminders to patients a couple of days before their visit. The second agent we've built, his name is Jay, so he finds unused appointment slots and then proactively calls overdue patients to get them scheduled. A bunch of people didn't even realize that it was an AI, about a third of the people that responded to the survey. And the vast majority of people that responded to our survey were actually delighted that we were taking an innovative approach to solve this problem. We've seen a really significant business impact after launching Ava and Jay in partnership with Retell. First and foremost, around NPS, our satisfaction scores, we've seen a 38% rise, specifically when we ask about scheduling and how it's going. The second big impact is around successfully filling up that underutilized PCP schedule capacity. Jay successfully books visits about 55.7% of the time when he connects with one of our outbound scheduling efforts. The third big impact that we've had, we've recouped 2.1 FTE of medical assistant time that we've been able to deploy back to much more complex, much more meaningful patient interactions. If you ask me what I would say to another operator building a medical practice like ours, I would say, be forward-looking. Don't be afraid of this. There's certainly a lot of details that need to work out. You're gonna have to really get into the weeds and get into the details and make sure that you get it right. But I'll tell you that Retell's been a great partner for us on the technology front, on the workflow front, and really on the patient experience side.